2020 has been a year like no other, with the COVID-19 pandemic upending almost every aspect of our lives. But this month offers a glimmer of hope the pandemic could come to an end. Canada has started its largest vaccination campaign in history. While it's good news, public health restrictions will continue to play a key role in the weeks and months ahead. Leading the federal response to the pandemic is Chief Public Health Officer Dr. Theresa Tam. She joins me now to talk about the year that was and what 2021 might look like. Hi, Dr. Tam. Great pleasure to have you on our program. Thank you for making the time.
It's great to be here.
You recently said, Dr. Tam, the vaccine as it starts is not going to be enough to extinguish any fires. What exactly do you mean by that?
Well, I think this is an incredibly exciting week as we get started on the next stage of our response, which includes vaccines. That is incredible, and I think we should be very optimistic about it. But as you can see, that the initial doses of vaccine is quite small. That's going to ramp up, but it will ramp up fairly slowly for the first quarter. So I think at this juncture, it's really important that we keep up with public health advice and measures at the same time as we're gradually ramping up the vaccination program. And it will take quite a few months in order to vaccinate the majority of the population.
Is it safe to say that there won't be any fires out for the first 3 months of 2021? Like, what is when you're talking about extinguishing fires, even small ones, are you looking at a timeline likely beyond March of next year?
Well, right now, what we're observing is a escalation of cases day over day. So we have like over 6,000 cases a day, which means that we must do the best that we can, just as we did in the first way, to plank the curve. This resurgence is actually more difficult to manage, perhaps, than the first wave. And so I think you've seen chief public health officers across Canada trying to maintain some balance between controlling the pandemic and resuming some parts of normal life. It's so difficult to manage. And so this is a really precarious period of time where I actually think right now, if we don't reduce, as I said, reduce contact rates and get a deceleration in this epidemic, this pandemic situation, it's going to be so difficult for our hospitals to cope. And you can see hospital beds filling up and ICUs getting full. You really need to get things under control so that does not happen. The overwhelming of our public health system doesn't occur. So that is a really important challenge ahead of us in the months to come. At the same time, we know that the most vulnerable are our seniors, and especially those living in congregate settings such as care homes. And by vaccinating this population first and those who look after them and our people looking after direct patient care, we hope to actually begin to at least reduce the serious outcomes of this COVID-19 pandemic.
I'll tell you why I'm asking about a timeline, and I know it's hard to make specific projections, but I think so many people are watching this with the weight of the world on their shoulders, right? You know that you're facing these restrictions, you're worried about the increase in hospitalizations, for example, and you're wondering when you might be able to breathe a sigh of relief. At what point will you be able to breathe a sigh of relief, do you think? Is there a point, a parameter, a marking that for you, once X amount of the population is vaccinated, you will feel more at ease?
Well, so I think that the first quarter of 2021, we are only going to be able to probably aim for 6 million doses or 3 million people. So that's not enough to achieve a high level of immunity in the population. But if all goes well, we hope that the majority of the population will receive the vaccine by the fall. I think aiming for September is a really good sort of goalpost, because you want to get ahead of the next fall, if you like, when another wave could also escalate given all the right conditions. So I think this is our aspirational goal. But from sort of the spring onwards, we'll come out of the winter periods where respiratory pathogens normally escalate. And into that springtime, people can get outside more, and the vaccine supply will be, we expect it to be more plentiful. And so if you look at life in quarters of the next months to come, I think we're going to see a positive change throughout those quarters. That's how I would like to think about it anyways. So the next quarter is going to be the most difficult time, but I know that we've done it before and we can get through this together.
Let me return to what has to happen in the interim. I've heard you speak about, for example, some signs of success or effectiveness of what Manitoba has done, the severely strict, restrictions that have been put in place in that province. Do you think you need to see more of that across the country right now?
Well, every province and territory is a bit different, as you've seen in the epidemiology. But Manitoba had the cases and the hospitalization has got to a point where they really had to implement very strict measures. And my advice has always been, you need to institute these measures fast so that you can come out of them faster. So the longer we wait, the harder it is to control the escalation and come out of it. So so in Manitoba, we are seeing that flattening and beginning the downward curve of those cases. We need to manage that really carefully. Other areas that have seen a leveling off isn't seeing that downward turn. So they may need to increase their measures. And some areas are actually escalating still. And so more measures will need to take place. But this is a very difficult period of time, I think, for Canadians, because it's just ahead of the holiday season. We have to be really careful about gatherings and making sure we reduce those contacts, because if we don't, we will see the impact of these gatherings a couple of weeks later. And so we have to manage this very, very carefully.
Is there a certain part of the country that you're particularly worried about right now?
In terms of cases and escalations right now, the prairie provinces had been some of the key areas of concern. But really, pretty much all 6 of our biggest provinces are trying to get things under manageable control. So you're seeing Ontario and Quebec escalate some of the measures because some areas of those big provinces are not getting things under control. So it's really a bit of activity everywhere. But I would say that British Columbia is seeing some positive signs, as well as Manitoba, and other areas probably need to increase some of the measures. Some have only enacted these measures recently. So Alberta more recently, and you won't see that effect for a little while longer. But I think that we can see that these measures do work, as we have seen in the first wave and in Manitoba.
How worried, though, are you? I listened to you highlight, for example, gatherings and what they may do over Christmas. How worried are you about what January looks like? What is the worst case scenario from your perspective?
Well, the worst case scenario is that our health system can't cope. So first of all, let's look at the public health system. So there's no doubt that the number of tests being done per day has really increased during the second wave. But we've lost the ability to do contact tracing in a number of areas of Canada because the number of contacts is too big. So if you get 6,300 cases a day and each one of them has quite a few contacts, you can imagine how difficult that is. And public health isn't coping very well in certain areas of the country. That's not a good sign because the fundamental public health response is testing, contact tracing, and isolation. And people are not able to keep up with that. And therefore, these restrictive measures, although public health is quite reluctant to do this because it has negative impacts, people are having to do that again. Secondly, the concern is the overwhelming of our hospitals and ICUs. And that's not just an impact on COVID response, it's an impact on the ability of the system to look after other patients with serious illnesses as well.
So this is the final interview we'll conduct with you prior to the end of the year. And as such, I was telling you in the break that I've been thinking back to the beginning of January and what I didn't know then and what a year it ended up being. When you look back, is there, and I know that you probably don't have a lot of time for reflection at this point, but when you do, is there something that you would have done differently?
I think for Canada, the major challenge in our response was long-term care and congregate living settings for seniors. So I think we have to, be able to respond so much better to that. So that was really the fundamental challenge in that first wave. And if we collectively, and of course, long-term care is mainly a provincial jurisdiction, but I think I've always said it's a collective societal response, and that if that area had been better able to respond, then we could have kept the virus out of those settings, particularly in our two biggest provinces. We would have had much less impact. So that's always going to, I think, remain Canada's difficult history. But having said that, and you've just, with Dr. Nima, is that the vaccine endeavor is so tremendous, like the global response and coming out with a vaccine before the year ends is a tremendous achievement. And I think we should look at 2021 with a positive outlook and remain optimistic.
Okay, I'll leave it on that note. Thank you, Dr. Tam. I appreciate your time and wishing you the best during the holidays.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.